All right, let's jump into another deep dive. Today, we're going to be looking at something that I think we've all experienced at some point, and that is vomiting.
Yeah.
But specifically, we're going to be focusing on what causes it, and especially related to brain obstructions.
Yeah.
So for this deep dive, we've got some pretty intriguing medical articles that we've been digging through in both English and Arabic.
Okay.
So we've really got a kind of global perspective on this.
Excellent.
And just a little teaser here. We're going to talk about the connection between eye health and vomiting, which I thought was really surprising.
It is fascinating, isn't it? Vomiting itself isn't a disease, right? It's a symptom.
Yeah.
And it can have a whole bunch of different causes.
Right.
Essentially, your body's just trying to get rid of something that's doing it harm.
So it's like a message.
Exactly.
Our body saying, hey, pay attention to this.
You got it.
Figure this out.
Yeah. And like any message, we need to decode it, right? We need to figure out what's the root cause of this vomiting. Oh. And that's going to involve considering, other symptoms or the circumstances.
Yeah.
So we can kind of broadly categorize vomiting as either acute, which means it's short-term, or chronic, which means that it's a longer-term issue.
So something like food poisoning would be acute.
Exactly. Food poisoning is a very, very common culprit
Yeah.
for acute vomiting.
Yeah.
And it can be caused by a variety of things. You've got viruses like norovirus,
Right.
bacteria like salmonella.
And what I thought was interesting in the research is just how quickly sometimes those symptoms can hit with certain kinds of food poisoning.
Yeah.
Like the ones caused by the toxins from Bacillus cereus and Staphylococcus aureus.
That's right.
You eat something bad and then immediately you're sick.
But beyond those common causes, though, vomiting can also be a red flag for much more serious conditions.
Oh, okay.
So if you're experiencing fever or dehydration or an inability to keep even water down, it's really, really important to get medical attention immediately.
So vomiting plus these additional symptoms.
Yes.
Could be a sign that something more serious is happening.
Exactly.
What kind of serious conditions are we talking about?
Well, it could indicate appendicitis, pancreatitis, even diabetic ketoacidosis.
Wow.
All situations that require urgent medical care.
Yeah, okay. That makes sense. Now let's shift gears a bit and talk about the thing you really wanted to know about, which is vomiting related to brain obstructions.
Yes.
This is where things get really interesting.
Yes, it is. To understand this, we need to talk about cerebrospinal fluid, or CSF for short.
Okay.
It's the fluid that basically surrounds and cushions your brain and your spinal cord.
Okay, so how does CSF play a role when there is an obstruction in the brain and that causes vomiting?
Well, think about it like this. Imagine the CSF flowing through your brain like a complex system of channels.
Okay.
When there's an obstruction, it's like a blockage in one of those channels.
Oh.
So that's going to disrupt that nice, smooth flow. And that blockage is going to cause pressure to build up inside the skull. And that's a condition we call intracranial pressure.
So it's not the obstruction itself.
No.
That's directly causing the vomiting. It's the pressure.
It's the pressure.
That's building up because of it.
You got it. And that pressure, that intracranial pressure, can actually irritate the vomiting center in your brain. And that's what makes you feel that urge to throw up.
Interesting. So that explains the mechanism.
Yeah.
But what kinds of things would actually cause an obstruction to happen in the first place?
Well, there are a number of possibilities. One is something called hydrocephalus.
Okay.
And this is a condition where excess CSF accumulates in the brain.
Okay.
So you've got all this extra fluid, and it further increases that intracranial pressure that we were talking about.
Now, hydrocephalus, it can affect people of all ages, right? It's not just infants like I think a lot of people think.
That's right. It's often diagnosed in babies, but it can develop at any age.
Okay.
Due to, a variety of factors, head injuries, infections, even tumors.
And so hydrocephalus, it doesn't just cause vomiting, right? There's other symptoms as well.
That's right. Vomiting is just one piece of the puzzle.
Okay.
Hydrocephalus can also cause headaches. It can cause vision problems, and it can cause changes in mental state, particularly in adults.
Interesting. We also came across meningitis in our research.
Yes.
Which the sources kind of highlighted as a serious condition.
Meningitis is definitely something to take seriously. It's an inflammation of the meninges,
Okay.
the membranes that surround your brain and spinal cord.
Right.
And this inflammation can also obstruct the CSF flow, leading to that increased intracranial pressure and vomiting.
So meningitis, hydrocephalus,
Yeah.
both disrupting that CSF flow,
Yeah.
ultimately leading to vomiting.
Right.
But meningitis has its own set of unique symptoms that kind of come along with it.
Absolutely. With meningitis, you'll often see a stiff neck, high fever sensitivity to light, along with the headache and the vomiting.
So meningitis sounds pretty scary.
Yeah?
Sounds like you need to seek urgent care if you suspect you have it.
You're absolutely right. Early diagnosis and treatment are key with meningitis because it can progress really rapidly and lead to serious complications.
What about strokes and brain tumors?
Yeah.
Our sources mention those as well.
Strokes and brain tumors can also cause vomiting by impacting the brain and that CSF flow.
Can you kind of break down how each of those do that?
Sure, so let's start with strokes. A stroke happens when the blood flow to a part of the brain is interrupted.
Okay.
And that can happen because of a blockage in a blood vessel, which is called an ischemic stroke, or a rupture in a blood vessel, which is called a hemorrhagic stroke.
Oh, yeah?
Both types of stroke can damage the brain tissue, and that leads to swelling and increases that pressure inside the skull.
There's the intracranial pressure.
Exactly. Now, brain tumors, on the other hand, those are abnormal growths
Yeah.
that can put pressure on the surrounding brain tissue
Right.
and obstruct that normal flow of CSF.
Okay.
And the symptoms of a brain tumor can vary quite a bit depending on, the size and the location of the tumor.
The research mentioned that sometimes brain tumors can even mimic the symptoms of migraines.
That's an important point. Both migraines and brain tumors can cause headaches, nausea, and vomiting.
Yeah.
But there's a key difference. Migraine symptoms usually follow a distinct pattern,
Okay.
whereas the symptoms of a brain tumor tend to get progressively worse over time.
So if you're having like recurring headaches and they're increasing in intensity and frequency,
Yeah,
along with vomiting, then you should maybe consider
it's a possibility.
brain tumor.
Precisely. It's essential to rule out serious conditions like that when you're evaluating persistent headaches and vomiting.
Now remember that surprising connection to eye health I mentioned at the beginning.
Oh,
It's
yes.
time to circle back to that. We're talking about binocular vision dysfunction
Yes.
and glaucoma.
Ah, yes. Those are fascinating examples of how seemingly unrelated systems in the body can actually be interconnected.
Yeah, I'm really curious about binocular vision dysfunction.
Okay.
How can misaligned eyes actually cause someone to vomit?
Well, it all comes down to how our brains process visual information.
Okay.
In binocular vision dysfunction, the eyes aren't properly aligned,
Right.
which means the brain is receiving two slightly different images.
Uh-huh.
And this mismatch that can cause eye strain, it can cause headaches, and in some cases, it can even lead to nausea and vomiting as the brain is kind of struggling to make sense of those conflicting visual inputs.
That's pretty wild. And then glaucoma. I know that can be a really serious eye condition.
It can be.
How does that tie into all of this?
Well, glaucoma is often associated with that gradual loss of peripheral vision
Right.
due to damage to the optic nerve.
Uh-huh.
However, there's a type called acute angle closure glaucoma where there's a sudden blockage of fluid drainage in the eye.
Yep.
And this causes a rapid increase in pressure within the eye itself.
And so that pressure can cause vomiting.
Yes, it can.
Yeah.
The intense pressure in the eye triggers nausea and vomiting, along with severe eye pain, blurred vision, and even halos around lights.
So acute angle closure glaucoma
Yeah.
is a real medical emergency.
It absolutely is.
Okay.
It requires immediate medical attention to prevent permanent vision loss.
So before we move on, what are some of the key warning signs
Okay.
that people should watch for when it comes to potential brain obstructions?
We'll keep a watchful eye out for any severe headaches, confusion seizures, and any changes in vision.
Yeah.
Those are potential red flags that something more serious could be going on.
So vomiting, especially along with any of these other symptoms that we've talked about,
Yes,
should be taken seriously.
absolutely.
And you should probably go talk to your doctor.
I agree. It's always better to err on the side of caution and seek medical advice if you're having any concerns about your health.
This has been a really insightful deep dive so far.
It has.
We've explored,
Mm-hmm.
the diverse causes of vomiting, especially those linked to brain obstructions.
Yeah,
And uncovered some really fascinating connections.
absolutely. We've learned about everything from food poisoning to hydrocephalus,
Yeah.
strokes, brain tumors, even those links to eye health.
Yeah, it's really amazing.
It's a complex topic,
Yeah.
but understanding these connections, I think, is really key to taking charge of your own health.
Before we wrap up,
Yeah.
what's one thing that really stands out to you as like the most intriguing aspect of this whole thing?
You know what I find truly remarkable is the interconnectedness of all of our bodily systems.
Yeah.
It's amazing how a problem in one area, like the brain, can actually manifest as a symptom in a completely different area, like the digestive system.
Right.
It really highlights that intricate web that makes up the human experience.
And that's what makes these deep dives so fascinating, right?
Yeah.
Uncovering those hidden connections and getting a deeper understanding of how our bodies work.
Absolutely.
We've covered a lot of information today,
We have.
and I'm sure you're eager to hear more.
I am.
So let's take a moment to process all of this.
Okay.
We'll be right back to continue our deep dive into the world of vomiting and brain obstructions. Welcome back to our deep dive into vomiting, and specifically focusing on the times where it's related to brain obstructions.
Yeah, as we've been talking about, it's a complex topic,
It is.
but one that's worth understanding. And, as we've discussed vomiting, it's often a symptom of an underlying issue rather than a problem in and of itself.
Right, and when it comes to the brain, the causes can range, from something fairly common like hydrocephalus to something more serious like strokes and brain tumors.
Exactly. And, each of those presents its own unique challenges in terms of diagnosis and treatment.
Let's delve a bit deeper into some of these conditions, starting with hydrocephalus. We talked earlier about how it involves that buildup of CSF in the brain,
Yes.
leading to increased intracranial pressure.
Mm-hmm.
How do doctors go about diagnosing and treating hydrocephalus?
Well, diagnosing hydrocephalus often begins with a neurological exam,
Sure.
where they assess things like reflexes, coordination, mental state. Imaging studies are also crucial, like CT scans or MRIs.
Oh.
Those allow them to actually visualize the brain, and they can identify any abnormalities in the ventricles, which are the spaces in the brain where that CSF is produced and circulates.
So they're looking for clues, both physical and visual,
Right.
to kind of pinpoint what's going on.
Exactly. And once they have a clear picture, then they can determine the best course of treatment.
And what do those treatment options look like?
Well, the most common treatment for hydrocephalus is surgery to place something called a shunt.
Okay.
And a shunt, it's basically a thin tube that's inserted to divert that excess CSF from the brain to another part of the body, typically the abdomen, where it can be absorbed.
So it's like creating a detour
Yeah, like a bypass.
for that CSF to go
Exactly.
to relieve that pressure.
You got it. It allows it to bypass the blockage, relieve the pressure on the brain.
We also discussed meningitis a little bit earlier,
Yeah.
highlighting, its seriousness and the need for urgent care.
Yes.
How is meningitis diagnosed and treated?
Well, when meningitis is suspected, doctors typically perform a lumbar puncture,
Okay.
which is also known as a spinal tap. And this procedure involves collecting a sample of CSF from the lower back to analyze for any signs of infection or inflammation.
So the CSF itself can tell us a lot.
Exactly. It can reveal a lot of crucial information about what's happening in the brain and spinal cord.
So in addition to the lumbar puncture, they might do blood tests and things like that?
Yeah, they might order blood tests. They might order imaging studies to help confirm the diagnosis and determine the best course of treatment.
And so how is meningitis typically treated then?
Well, it really depends on the underlying cause.
Okay.
Bacterial meningitis is a serious infection that requires intravenous antibiotics to fight those bacteria.
Okay.
Viral meningitis, on the other hand, often resolves on its own
Okay.
with supportive care, such as, rest and fluids,
So you really have to figure out,
to determine which one it is
is it material or viral?
to treat it properly.
Exactly. That's why prompt medical attention is so important when meningitis is suspected.
Now let's shift our focus over to strokes.
Which, as we mentioned, can also disrupt that CSF flow
Right.
and lead to vomiting.
Yeah.
You described earlier how strokes are caused by either a blockage or a rupture
Yes,
in a blood vessel in the brain.
that's right.
Can you elaborate a little bit on the specific treatment approaches for each type of stroke?
Sure. So for ischemic strokes, those are the ones that are caused by a blockage. The primary goal is to restore blood flow to the affected area of the brain as quickly as possible.
So it's a race against time
It is.
to try and prevent further damage.
Exactly. The faster blood flow can be restored, the better the chances of recovery.
And what about hemorrhagic strokes, the ones caused by a rupture?
Hemorrhagic strokes require a different approach. The focus there is on controlling the bleeding and reducing pressure on the brain.
Okay.
That might involve medications to lower blood pressure or even surgery to repair that ruptured blood vessel.
So it's a delicate balance
It is?
between stopping the bleed,
Yeah.
but then also minimizing damage.
Right. That's a good way to put it. Stroke treatment requires a highly individualized approach.
Yeah.
Based on the specific type, the location, and the severity of the stroke.
Now on to brain tumors.
Okay.
We talked about how they can compress brain tissue, disrupt that CSF flow,
Yeah.
leading to a whole variety of symptoms, including vomiting.
Yes.
What can you tell us about how brain tumors are diagnosed and treated?
Well, diagnosing brain tumors often starts with a thorough neurological exam and imaging studies,
Okay.
things like MRI or CT scans.
Uh-huh.
Those provide detailed images of the brain, allowing doctors to identify any abnormal growths.
So again, it's looking at both the physical and then the visual evidence.
Precisely.
Mhm.
And depending on the size, the location, and the type of tumor, a biopsy might also be performed
Okay.
to actually obtain a tissue sample for further analysis.
Once the diagnosis is confirmed, what are the typical treatment options?
Well, treatment for brain tumors varies widely.
Yeah.
It depends on a lot of factors, the type of tumor, the location, the patient's age, and overall health. But surgery is often the first line of treatment,
Mm-hmm.
especially for tumors that are accessible and hasn't spread.
So if they can, they'll try to remove it
That's the goal.
completely.
The ideal scenario, yes. But in some cases, complete removal may not be feasible because of the tumor's location
Uh-huh.
or if it involves any critical brain structures.
So what other treatment options are there then?
Well, radiation therapy is another common approach
Okay.
that uses high-energy beams to target and destroy tumor cells.
Uh-huh.
Chemotherapy might also be used to kill the cancer cells or to slow their growth.
It sounds like treating a brain tumor can be quite a complex.
It often involves a multidisciplinary approach,
Yeah.
combining different therapies to achieve the best possible outcome.
I want to circle back to something that we touched upon earlier,
Okay.
which is that fascinating connection between eye health and vomiting.
Yes.
Specifically, we talk about binocular vision dysfunction and glaucoma.
Right.
Can you remind us how those can actually trigger vomiting?
Sure. So binocular vision dysfunction, as we discussed, it occurs when the eyes aren't properly aligned,
Mm-hmm.
and that mismatch in the visual input can confuse the brain,
Right.
lead to eye strain headaches, and in some cases, nausea and vomiting.
So the brain's like, wait a minute,
Yeah, it's trying to reconcile.
what am I seeing here?
Exactly.
And then with glaucoma,
Yeah, with glaucoma, that buildup of pressure within the eye
Yeah.
can irritate the optic nerve, which, transmits visual information to the brain.
right.
And that irritation can trigger a cascade of effects, including nausea and vomiting, especially in acute angle closure glaucoma.
We highlighted the importance of seeking medical attention
Yes.
immediately
Yeah,
for acute angle closure glaucoma.
absolutely.
Can you remind us why that is?
Absolutely. Acute angle closure glaucoma is a true medical emergency.
Okay.
That rapid increase in eye pressure can permanently damage the optic nerve,
Oh, wow.
leading to vision loss if it's not treated promptly.
So time is really of the essence.
It is. The sooner treatment is initiated, the better the chances of preserving vision.
We've covered a lot of ground
We,
in this deep dive.
yes.
Exploring, the many causes of vomiting.
Yeah.
Particularly those related to brain obstructions,
Okay.
and discuss the complexities of diagnosing and treating conditions like hydrocephalus meningitis strokes, brain tumors,
And even eye-related issues.
and even eye-related issues.
It's like binocular vision dysfunction and glaucoma.
It's a testament to how everything is connected.
Yeah, it is. It's a reminder that, seemingly simple symptoms like vomiting
Yeah.
can have very complex origins.
Before we wrap up, what's one key takeaway
Yeah.
that you would want our listeners to remember from this whole thing?
If I had to choose one, it would be pay attention to your body and trust your instincts.
Yeah.
If you're experiencing vomiting, especially if it's accompanied by other warning signs like severe headaches, confusion, seizures, vision problems, don't hesitate to seek medical advice.
It's always better to be safe than sorry.
I agree. Early detection and intervention can make a world of difference in managing these conditions and improving outcomes.
This has been an incredible deep dive,
It has.
packed with, I think, a lot of really valuable information.
Yeah.
But before we conclude, let's take just a short break to let everything sink in.
Okay.
We'll be right back with some final thoughts and resources to help you continue exploring this topic. Welcome back. We've been on quite a journey exploring this whole world of vomiting and its connection to brain obstructions.
Yeah, it really has been a deep dive. And, while vomiting might seem like a really basic bodily function,
Right.
we've seen that it can actually be a sign of something much more complex happening, under the surface.
Yeah, absolutely. We've covered so many potential causes, from the common culprits like food poisoning
Right.
to more serious conditions like hydrocephalus meningitis, strokes, brain tumors,
Yeah, even those eye-related issues.
binocular vision dysfunction, and glaucoma.
It's really remarkable, isn't it? Just how interconnected all of our body systems are.
It is.
It's a reminder that, seemingly minor symptoms can actually be clues to something, much bigger.
Yeah, one thing that really struck me throughout this deep dive is just the importance of listening to our bodies
Yeah.
and advocating for our own health.
I think that's such a crucial point.
Yeah.
You know, we often dismiss or downplay symptoms like vomiting,
Yeah.
especially if they seem isolated or short-lived.
Right.
But as we've discussed, it can be a powerful signal that something's not right.
And so understanding those signals,
Yeah.
recognizing those red flags,
Right.
knowing when to actually seek medical attention can make all the difference.
Precisely. We talked about, warning signs like severe headaches, confusion seizures, vision changes.
Right.
Those, in conjunction with vomiting, definitely warrant immediate medical attention.
Yeah, it's all about empowering ourselves with knowledge.
Yes.
And becoming active participants in our own healthcare journey.
Absolutely. Knowledge is power, especially when it comes to our health. The more we understand about our bodies and the potential causes of symptoms like vomiting,
Right.
the better equipped we are to advocate for ourselves.
Yeah.
And to make informed decisions.
We've covered a lot today, but this is really just the beginning
It is.
of this whole exploration.
Yeah, there's always more to learn and discover.
And we encourage you to continue digging deeper,
Absolutely.
exploring the resources we mentioned, and
Yeah.
asking questions.
Resources like the Mayo Clinic,
Yeah.
the National Institutes of Health,
Right.
the NIH,
Right.
the American Academy of Ophthalmology. Those are great places to start.
Excellent resources.
Yeah.
And, don't underestimate the power of simply talking to your doctor.
Yeah.
They're your partner in this
They are?
and can provide you with personalized guidance and support.
Absolutely.
So as we wrap up this deep dive into the world of vomiting and brain obstructions, we leave you with this thought.
How can this new knowledge empower you to take charge of your health and to make more informed decisions about your well-being?
Remember, your health is your most valuable asset. Be proactive, be informed, and don't hesitate to seek help when you need it.
Great advice.
Until next time, keep those brains buzzing and stay curious.